Imagine waking up soaked in last night's rain, your sleeping bag stiff and bloody where you pressed it into broken glass. They call it public safety, but try explaining that as you cough shards of pavement from your lungs. The air smells of bleach and burnt rubber, perfume concocted by all the places you're not allowed to be. Every breath tastes like exclusion. You score a hit in an alley behind a liquor store, your sanctuary of shame. Fingers numb from the cold, you cup the foil, ignite the flame, and inhale jagged relief. It isn't pleasure, it's sonar, pinging the darkness inside your skull so you don't hear the screams. With each hit, you erase another fragment of yourself, memories of laughter, of hope, of a child's face you can't keep. You're not just homeless, you're erased. A bleed through on society's whitewashed walls. When patrol cars roll by, you don't scramble to hide, you can't run. Your feet ache from week old wounds, and fear has seared your legs to the curb. They shout, "Move on," like they're shepherds guiding sheep, but you're neither sheep nor shepherd. You're roadkill they'd rather leave unclaimed. Move along, they say, but there's nowhere to go. Every park bench carries a no-sit sign, every doorway a glare. So you stay, a vandal on the city's margin. They built clinics and cold weather shelters plastered "Help us here" on glossy posters, then staffed them with overworked social workers who have no beds left. They promise treatment, then shotgun you into waiting lists months long. A phone tree that leaves you sobbing into voicemail. You learned to call once. You trembled at the receptionist's voice, begged for a slot, transferred you twice, then they dropped the line. You held the receiver to your ear until it went dead, and that's when you learned the truth. Help is a myth. And yet, despite it all, you're still alive. You dragged your shattered body through neon lit streets so you could sleep in your bed believing public safety means everyone's protected. But their safety, their comfort is built on your suffering. Every siren, every eviction notice is a lullaby for them, a promise that they'll never know this pain. Take that lullaby and shove it. True safety would be a hand that catches you before you crack. True safety would be the freedom to exist, to breathe without accusation. But until you dismantle these walls of indifference, public safety will remain the cruelest irony of all. From January through September 2024, 1,749 British Columbians died from poisoned street drugs. That's 6 people every single day, 1 every 4 hours. Picture the one you love most gasping for their last breath, while the very system set up to protect us stand by with handcuffs instead of a helping hand. Let's stop sugarcoating it. Criminalizing drug use is literally a death sentence. Arrests aren't aid. From February through July 2023, the first 6 months of BC's Decrim pilot, possession charges plummeted by 76%. Instead of roughly 4,300 cases every half year, police filed just 1,113. Big news, right? Except here's the brutal truth. Nothing about the overdose crisis changed otherwise. Nearly 200 people were still dying every single month. Decrim peeled away one layer of the state's cruelty. No more arrests for having dope. But it didn't shove in anything meaningful to replace it. Folks whose charges were dropped still face the same toxic, unregulated supply, the same empty promises of treatment, and the same brick wall of "not our problem" from health services. Taking away handcuffs without handing out care is like ripping off a band-aid and leaving the wound to fester. Let's cut the crap. Criminalizing drug use has never stopped drug use. It just made people go into the shadows, where they huddle alone, scared to call for help, where they end up dying in silence. Decrim without safe supply, without peer-led leadership and support, without real harm reduction is just window dressing. The state can lower arrest all it wants, but until we flood communities with life-saving options, safe supply, peer-led leadership outreach, cultural safe services, people will keep dying. Punishment is a death sentence. Only compassionate, evidence-driven care can save lives. Locking someone up because they need help? That's not justice, it's a death sentence. Jailing people for using drugs doesn't fix why they're in pain. It shoves them deeper into hell. Look at the cold, hard numbers. Someone walking out of prison is 56 times more likely to overdose in the first 2 weeks than anyone else. 38.8 deaths per 1,000 person years versus 1.2. That's a slaughterhouse built on shame and outdated laws that treat addiction like a crime instead of the health crisis it actually is. Get this. Almost 2 out of every 3 overdose deaths happen after someone's been locked up for simple possession. Throwing people in a cell for carrying a little bit of dope isn't justice, it's a straight up murder. Most of these folks aren't even hardened criminals. They're slammed by poverty, haunted by trauma, and shut out by a healthcare system that has tossed them aside. We brand them as lawbreakers instead of giving them the help they desperately need, and then no one is surprised when they die. That's not public safety, that's cold blooded neglect. When someone gets thrown in jail, their body goes into shock. Cut off cold from the drugs they depended on, their tolerance crashes to almost zero. Then, without a second thought, we kick them back out onto the streets. No treatment, no supervised detox, no follow up, nothing. They walk right back into the same environments, the same pain, the same trauma, and now with a body that can't handle what it once could. One hit kills them, and usually does. It's a system working exactly as it was built, punishing people for surviving a broken world and then blaming them when they die. We pretend jail is some necessary evil for rehab. We say, or justice. But here's the brutal truth. People behind bars are dying in droves. And almost all of those deaths could have been stopped, could have been prevented with real health care, real treatment, and real support. These aren't tragic exceptions. They're exactly what you get when you treat a health emergency like a crime. Every time we dump someone back onto the street, straight from a cell, with zero plan for their addiction, we've already signed their death certificate. And the kicker? We tell ourselves it's all in the name of public safety. Here's the hard truth. We're not keeping anyone safe. Not the community, not the people we lock up, not the families left by a system that chews people up and spits out their bodies. This isn't about individual failure. It's about a system that chooses punishment over healing, cages over care, and cruelty over compassion. This is how we kill people legally every damn day. And it's about time we stop lying to ourselves about it. Homelessness criminalized, humanity denied. In 2023, 419 people experiencing homelessness died in BC, almost 90% of them from unregulated drug toxicity. That's 3 lives lost every week. Bodies left out in the cold, in doorways, parks, under bridges, and in makeshift camps. These aren't just statistics. They're people we forced into invisibility, scrambling to survive in places we'd rather ignore. They already carry a mountain of trauma, mental health struggles, systemic neglect, and addiction. And what do? We pass laws that criminalize their very right to exist. While people are literally fighting to stay alive on the streets, cities are busy ticketing them for pitching a tent. In 2023 alone, over 12,000 encampment violations were slapped on folks living in tents or makeshift shelters. Fines that rack up to the thousands. Yet none of that went towards housing or harm reduction. We're out here criminalizing survival, fining people for not having a home like homelessness itself is a crime, rather than a symptom of a society that's already failed them. And the sweeps, these inhumane actions that tear down shelters and push people from one place to another, do nothing but make the situation worse. Never mind the fact that when you tell somebody when they're out in a public space that they need to move, even though everybody has a right to take up space in public, that technically is violating their human rights. Every sweep scatters people, pushing them to the hidden corners of our cities where they're more likely to overdose without anyone noticing. In these concealed places, overdose rates are double the city's average. The isolation is complete. Their deaths become invisible. No one sees them. No one knows they even exist until their body is found. Cold, alone, far from anyone who would have cared. These policies are designed to erase, push people out of sight, out of mind. They don't stop the deaths, they cause them. The very actions meant to solve the crisis only worsen it. The more we criminalize homelessness, the more we deny people their basic humanity, the right to live with dignity, the right to exist without fear of being punished for their circumstances. When we criminalize homelessness, we condemn people to lives of invisibility, fear, and eventual death. Criminalizing survival doesn't reduce homelessness. It doesn't provide housing. It doesn't help people. It just deepens the divide between those who have the luxury of being seen and those whose very existence is criminalized. These policies don't just fail, they actively destroy. They create a vicious cycle of erasure, isolation, and death, and we are complicit in it. Every time we choose to fine, sweep, or push people to the margins, we become part of the system that continues to fuel the very crisis we claim to want to solve. We need to stop kidding ourselves that criminalizing homelessness is a solution. It's the problem. It's a policy that kills, and we have the power to end it by choosing compassion over punishment, visibility over invisibility, and humanity over criminalization. The real question is, are we going to keep letting this system destroy lives? Number 4, the profit in punishment. In 2023, BC blew 87 million over 3 years, about 29 million every single year, just to keep people behind bars under the Safer Communities Action Plan. Meanwhile, police seizures of small drug amounts under the 2.5 gram decrim cutoff cratered from 1,463 to 41 in that same February-July 2023 window, a 97% drop. That drop should scream that criminalization is dying on its feet. Instead, the system doubles down on cages and courtrooms. Why? Because there's money in punishment. We sink tens of millions into lockups and legal machinery knowing it doesn't fix anything. It only feeds the beast. Every arrest is another chance to seize someone's last possessions and justify more enforcement. And when it comes to funding life-saving measures, suddenly the budget is too tight. So tell me this, why can the province afford to incarcerate people by the thousands, but can't spare a fraction of that cash to save them? Why build more jails while safe consumption sites and overdose prevention programs starve? The answer is ugly. The system profits from people's suffering. And once someone's released with no supports in place, their odds of survival haven't improved. They've only gotten a million times worse. This isn't about keeping communities safe. It's about keeping the punishment profit machine humming. If we don't flip the script, shifting every dollar from punishment to prevention, from cages to compassion, we're not just bystanders, we're accessories to a system that banks on human devastation. How long are we going to let this slide? Stigma, the invisible chain. Remember that saying, sticks and stones can break my bones, but words will never hurt me? Well, they were wrong. Words can actually hurt deeper than physical chains, creating invisible, lifelong barriers that lock people in a prison of shame, isolation, and hopelessness. Stigma is an insidious force woven into the fabric of our society, and it criminalizes not just substance use, but the very existence of those who experience it. The power of stigma isn't just in how it is spoken, it's in how it is felt. In a 2024 scoping review, nearly 45% of youth who use drugs in British Columbia identified stigma from healthcare providers as a top barrier to accessing harm reduction services. That's nearly half of the young people trying to seek help actively turned away because of judgment, because of labels, because the system refused to see them as human beings worthy of care. Stigma is a brick wall in the way of accessing support. It denies people their right to heal. It's a lethal barrier that leads to untold suffering, both physical and psychological. And for Indigenous women, the stakes are even uglier. One minor possession charge can wreck more than a record. It can rip families apart for generations. Indigenous women with any drug charge are 4 times more likely to have their kids snatched by child welfare agencies. That's cultural genocide disguised as law and order. We aren't just criminalizing substance use, we're weaponizing it against entire communities, tearing kinship networks to shreds. Criminal records aren't just paperwork, they're life sentences. Every label, junkie, crackhead, addict, criminal, unfit, is another chain wrapped tight around someone's future. These words don't just sting, they trap people in the same broken system that forced them to use in the first place. When you're branded with these labels, you lose housing, jobs, custody, your entire life. Not a misfortune. It's a deliberate strategy to keep people down and off the radar. Here's the brutal truth. Stigma is not an accident, it's a policy choice. Every time we let doctors judge, social workers exclude, and judges convict, we're choosing cruelty over care. Until we smash these systems of shame, we'll keep watching people suffocate under labels they never asked for. Healing doesn't kick off with courtroom threats, it starts with compassion, with actually seeing someone as a human being worth saving. Anything less is choosing to kill them with your words. Peer power, evidence, and action. Peers walk the streets with harm reduction supplies and the truth of survival. They don't need authority to save lives. They already have the one thing the system can't buy: trust born from having walked the same shoes. Peer led areas see overdose deaths drop by anywhere from 55 to 89%. That's not just a little, that's saving lives. When someone who's been there hands you the harm reduction supplies or talks you through the anxiety you feel, they're doing what cops and clinics have failed to do for decades. The trust forged in these relationships is the sharpest weapon we've got against this crisis. Appears I got you can pull someone back from the edge in ways no judge or doctor ever could. They're the first break in the chain of shame and isolation that keeps people dying alone. Here's another hard number. Every dollar poured into peer programs yields $3 back in healthcare savings, lower ER visits, fewer hospital stays. Yet we starve these lifesavers while we pour tens of millions into cages and courtrooms. That's insanity. Peer work is the backbone of harm reduction, the most cost efficient, human centered approach to a disaster we caused. Until we fund peer leadership like we fund punishment, we'll keep watching people die, needlessly, preventably. It's on us to stop treating compassion as charity and start seeing it as our best damn strategy. Decriminalization works, period. Portugal tore up the punishment playbook in 2001 and saved lives. They decriminalized every drug, treated use as a health issue, and within 10 years saw HIV rates among people who injected drugs die by 70% and overdose deaths fall by 60%. That's tens of thousands of people pulled back from the brink by compassion and evidence, not cages and court dates. BC's pilot from January 2023 to January 2024 followed the same script and rang the same bell. Possession charges plunged 76%, proving once again that criminalization only drives people into the shadows. Drug use didn't skyrocket. Instead, referrals to treatment jumped 25% because when you stop threatening people with jail, they actually seek help. Here's the uncompromising truth. Decrim is a proven, life-saving strategy. Every day we cling to punishment is another day we sentence people to death by stigma, isolation, and unsafe supply. We have the data. We have the models. What we lack is the political will to choose care over cages. If we want fewer deaths, less disease, and real pathways to recovery, we stop treating substance use as a crime. We fund safe supply, peer-led leadership, culturally grounded supports, and accessible treatment. We tear down the walls of stigma and build bridges to healing. Decrim works, period. The only question left is whether we have the guts to follow the evidence that's right in front of our faces. Redirecting funds, reclaiming lives. Let me get right to the point. We spend $29 million every year locking people up. Money that could staff peer-led programs, mobile overdose vans, and 24/7 response sites from Victoria to the Valley. 2% of the corrections budget would cover it all. Instead, we choose cages over compassion, punishment over prevention. Those 29 million aren't solving anything, they're fueling the crisis. Pour that cash into peer workers with harm reduction supplies into mobile units that pull people back from the brink, into overdose response teams that meet folks where they're at, and you'll save hundreds of lives a year. You'll slash ER visits, hospital stays, and long-term care costs. Every dollar back threefold. Do we want to keep paying for death sentences? Or do we want to actually fund hope, healing, and restoration? Because make no mistake, we already pay. The only choice left is whether we pay with prisons or with prevention. Whose side are we on, anyways? Number 9, the reckoning. Criminalization is nothing more than a profit-hungry death machine, powered by shame and suffering. But this machine can be torn apart. We can rip out the policies that feed it, rewrite the rules, and redirect the cash to keep people alive instead of locking them up. Every set of handcuffs we toss aside is another hand we extend in solidarity. Every dollar we pull from enforcement restores dignity and saves lives. Handcuffs and cages don't fix a damn thing. This system was built to churn out profits for those who prey on marginalization, all while preaching order and safety. It's time we look this lie in the face. Criminalization doesn't cure the crisis, it fuels it. It's a cold, calculated machine designed to harvest revenue from human misery, and that's not our fate. We are not powerless. The heartbeat of change is already here, in the fierce resilience of communities that refuse to be silenced, in peer-run programs that actually save lives, and in the ones of us demanding accountability from the profiteers of punishment. Every pair of handcuffs that hits the floor is a step toward real healing. Every dollar we reroute from cages to community care is a vote for solidarity over stigma. This is our reckoning. We must stare down the system we built and remember, healthcare, not handcuffs. Thank you for listening to Detoxing the Discourse.